understand what you're saying. For a niche of patients who won't take their meds, this is a good idea. But for the vast majority, the blister packs that make it easy to distribute, give it a street value where you can easily sell it. And also kids, especially at those young ages before they're adolescents, don't have the judgment. I mean, my kids love gummy vitamins, and I have to keep telling them that you can't just eat these aren't candy. This makes me really nervous.
Well, and you highlight something that I want to, Paul, before we come back to you, that I think is really important is, when you talk about a blister pack, it's almost like popping out a piece of gum. Yeah. And when you think of taking medications, particularly with children, you tend to think of, okay, we've got the bottle, we're gonna measure the amount of liquid medication here, it's a process, and with these blister packs, it seems so benign. It just seems to me like this is going to get abused, Paul, because my fear is not the kids that really need it, it's the kids that really don't. How do we prevent amphetamines becoming, it's already on the way, becoming the next opiate epidemic in this country?
It's pretty tough. Unfortunately, if you talk to, again, I've been doing this for 12 years at Balboa Horizons, those patients will all say they went in and took a 22-page, 5-minute questionnaire to get their Adderall. And what used to be $20 a pill 5 years ago, 10 years ago, is now $10 a pill, so it's cheaper because it's so readily available.
And so, Dr. Sportelli, obviously you're prescribing these to people that need them. How do we prevent this from becoming such a big problem, which it already is becoming?
Yeah, no, listen, the frustration lies within me as well, and I see what you guys see as well. Various providers just freely prescribing these medications in a dangerous manner. So I think the responsibility lies, number one, with the prescriber, no question about it, and also parent and patient education. If we're going to give this to a child and a family, and they're that young, the parents are going to have to distribute the medication. They're going to have to keep it locked up. The potential for diversion is a scary thing, though, because these things will likely end up at a party with adolescents in some candy bowl like they're doing, which is very, very scary. But it's really going to be about, prescriber responsibility.
And I think your point is really well taken, that it isn't easy to make these diagnoses, so the kids really have to be adequately screened, and the amphetamines should never be the first therapeutic choice.
So, Dr. Sportelli, thank you very much for your insight on this. Paul as well, appreciate all the work that you're doing. The pharmaceutical company behind this medication says it's another option for patients who do not like to swallow pills or for kids who have never taken a pill. They had this to say about the medication: flavor is often added to medications for ADHD and other medical conditions to mask the unpleasant taste of active ingredients. Flavoring medications is not new in the ADHD category. This medication is the 6th flavored ADHD medication approved by the FDA. The company's marketing and advertising is directed to healthcare professionals, adult patients and ADHD, and caregivers of children with ADHD. Marketing directly to children is unethical and would never be considered by the company. Wow, no easy answers on this one.
Not at all.
But it is interesting that they did have a huge marketing spike right before back to school, and a soar in their profits really went up.
So educate yourselves, folks.